Hello, everyone. Welcome to the Wandering Podcast, where we take advisement from outside the box. I'm Rihanna Ritter, your host. I'm an intuitive, sexuality, and authentic expression coach. Are you an accomplished professional who plays the part of having it all figured out? Who's strong for everyone else, but feels lonely, misunderstood, like you can't tell anybody the truth about how stressed you are, how not passionate you are about your life and all that you've created? I guide my clients to deep, lasting fulfillment. I re-engage them with their bodies, their pleasure, their desire. I help them align to enjoy fulfillment and prosperity in all areas of their lives.
Today, my guest is Dr. David Clarke, President of the Association for Treatment of Neuroplastic Symptoms, a 501c3 nonprofit dedicated to ending the chronic pain epidemic. Dr. Clarke holds an MD from the University of Connecticut School of Medicine and is board certified in internal medicine and gastroenterology. His organization's mission is to advance the awareness, diagnosis, and treatment of stress-related and brain-generated medical conditions. Learn more at symptomatic.me. Welcome, Dr. Clarke. What are neuroplastic symptoms? And how
Great to be with you, Rihanna. Neuroplastic symptoms, it really starts with a basic assumption that people have that if you've got pain or illness, you must have a disease or injury to explain it. But it turns out there's a whole other category of illnesses, and those are what we call neuroplastic symptoms because they are generated in the brain or nervous system. And the plastic part in medical jargon means they have a capacity for change, either for bad or for better. Obviously, my organization is focused on changing them for the better. But it turns out that they can be just as severe and long-lasting as symptoms from any other cause. There's, really no difference in the severity or number or duration or type of symptoms that you can get from this condition than there is from organ diseases or structural damage. It's just that these symptoms are generated by changes in nerve circuits in the brain, which leads to the question, why would your brain do this? And it turns out that the circuits can be changed by stress, trauma, repressed emotions, adverse childhood experiences and their long-term effects, other challenges in life, all things that can happen to anybody. And the symptoms can occur even in people who are mentally perfectly strong and healthy. It's just a question of how much of a burden of stress you're carrying. And most of the time, people who have this, they don't realize the magnitude of what they're carrying. So a big part of the treatment is to help them see exactly what's going on. So long-winded answer, but it's important because it affects 1 in 5 adults and 2 in 5 people who go to see a physician about their symptoms. So it's millions of people.
Yeah, that makes a lot of sense. I think a lot of people like to believe that they hear about trauma or adverse childhood experiences that are really big and obvious from books and movies and things, people's stories, and they discount, even everyone feels disappointment in childhood. Everyone feels ignored at some point. And that can manifest as trauma, and it just may not be capital T trauma, might be. But if we don't process that emotion and we carry it around for the rest of our lives trying to pretend it's not there and escape it because we don't think it's that big of a deal, it can manifest in symptoms like these.
Yeah, if you're not consciously aware of it, then it just sits there and it causes physical symptoms in the body, and then people start to get worried, naturally. What's going on in my body? What kind of disease or injury have I got? Is it going to get worse? Am I going to be permanently disabled? What impact is it going to have in other areas of my life? And that fear, very naturally, that people have about this just makes the condition worse and leads to the symptoms getting even stronger, which leads to more fear, which leads to stronger symptoms. It can start with something as simple as, a tension headache or not in your abdomen when you're in a tense situation. Everybody's had those kinds of experiences. Another common mind to body one is if you get embarrassed, your face may flush red. Those are all very common brain to body experiences. But in this condition, if you get into that loop, that cycle of the fear leading to more stress, leading to more symptoms, it can build up over time until it's a full-blown illness. I've had patients who've suffered from this for decades. My personal record patient, 79 years. The level of pain that people can get can be extraordinary. One of my patients, I was asked to see a 17-year-old girl on her 70th day in the hospital, getting massive doses of morphine around the clock for unexplained abdominal pain. And both of those patients I just mentioned, 100% from a stress/trauma issue. And I know this because they were both successfully treated with neuroplastic psychology.
Can you describe what neuroplastic psychology is?
Yes, it is actually completely different than the prevailing type of psychotherapy out there, which is cognitive behavioral therapy, which is probably 80% of the psychotherapy that's out there. That turns out not to work especially well with people with neuroplastic symptoms. The difference is with the new kind of psychotherapy, the neuroplastic kind, is number one, it focuses on alleviating your symptoms, not just to help you live with them. Our goal is to actually make these symptoms go away, and we are successful in the vast majority of patients. Now, how do we do that? The first thing is we want to have people be assured that their bodies are okay. They've been through the diagnostic evaluation, and the doctors are not usually finding any structural abnormalities or organ diseases. If they do, it turns out that those are not responsible for the patient's symptoms. So that was why the title of my first book is They Can't Find Anything Wrong, because people go to the doctor, and so many of my patients have told me that, I went to the doctor and they can't find anything wrong. And I hear that over and over again. So I made it the title of the first book. But it turns out that if we can reassure people that the doctors are right, there isn't anything structurally wrong with your body that is producing these symptoms, that means we need to shift your attention to what's happening in your brain where these symptoms are actually being generated. And again, this is not in your head. People are not imagining this. There are anatomic changes in the circuits in the brain that are responsible for this. So it is just as real and just as physical as any other form of illness. It just happens to be getting started from up here. And the next step after that is, okay, what kinds of stresses are going on? Do you have a stress in your life at the moment? One of my patients, the only time, this is very simple, but the other doctors had missed it. The only time that he got his symptoms was when he was driving to work. When he was driving home from work, he was fine. On the weekends, when he was not at work, he was also fine. So, you don't even need to be a doctor to diagnose it when you get the story like that. He had massive stress in his workplace that coincided exactly in the timing with when his symptoms were going on. So that was very straightforward. With other people, it can be a lot more subtle. To maybe pick somebody from the opposite extreme of difficulty in figuring this out, was a patient that said, he really didn't have any stress in his life that he could think of. He didn't have any adversity as a child that he could think of. But as we talked, he began thinking more about, what kinds of issues he might have had as a kid that he would never want for a child of his own, for example. And that's a common question for me to ask people. And then he started nodding his head and he said, the only time I ever got praise or support from my parents was when I could do something better than my brothers and sisters could do it. And he had it turned out, three very accomplished siblings. I mean, they were good athletically, academically, in the arts. It was not easy to do something better than those kids could do it. And so as a result, he went through most of his childhood just feeling like a second-rate human being. And that is a huge burden to carry with you. And it went on into his adult years. It manifested in him trying to be perfect all the time, putting enormous pressure on himself, being extremely self-critical. Whenever he made a mistake, he would come down on himself way more than he ever would on a friend or colleague who made the same mistake. And that just ratcheted up the stress level in his life. And it led him to make some bad choices. So when I saw him, he was in his late 30s and he was having all kinds of physical symptoms over this, but it could all be traced back to, just really getting his self-esteem hammered at a time when he was a defenseless kid. So it took a while to figure that one out. It's not always the obvious big T traumas, as you point out, but it turns out even the traumas we might label as little t, like the one I just described, they can have massive impacts later on. So getting back to the neuroplastic psychology, we try to identify these things and help people see where they came from. And that enables us to help them make some changes, to reflect back on the fact that they went through a lot more stress than they recognized. And they should appreciate how tough it was and give themselves some credit for how much they overcame. And when they can do that, it makes a huge difference. People start to improve. There's more to neuroplastic psychology than that, but probably should stop there. That'll get you a good sense of where we start out.
Yeah, absolutely. That's so many people are afraid to talk about things like you just described, because that man may have thought that he lived a very charmed, privileged life in a family that was talented and successful. And people get this stigma around any complaint when they've lived that kind of life, that they're making it bigger in their head than it is, or that they have an overactive imagination, they're oversensitive, things like that come along with it. Because no doubt, when he was a kid and he wasn't getting that praise and there might have been some little acting out. And I'm sure that he was probably told that was, I don't know, spoiled or whatever. These things kind of build on each other.
Yes, they do. Yeah, it can take a while to appreciate. One of the exercises that I have people do, I've alluded to this already, but I'll have them imagine they are a butterfly on the wall of their childhood home, and they are having to watch a child that they care about living in that home for, let's just say, a week or so. And what's it going to be like to watch a kid that you care about try to cope with everything you had to deal with as a kid? And you can't do anything about it because you're just a butterfly on the wall. You just have to watch. Is that going to make you sad or angry, for example, to see that going on? And a lot of people who look back at their own lives, none of us has a parallel life to compare ourselves with. We can only look back and just see what it was we dealt with. And a lot of times, the magnitude of the difficulty is not recognized. And people will tell me it wasn't that bad. They'll tell me other people have been through worse, which is undoubtedly true. They'll tell me they think they're over it, but they've got these significant physical symptoms, and it is a direct outgrowth of this stress. And sometimes it doesn't happen while they're a kid or a teenager even. It can manifest in the middle of your life. My very first patient, she had been sexually abused as a girl. That stopped happening at age 12. Her physical symptoms didn't start until she was 35. And what was going on in the middle was, she was gradually recovering from the sexual abuse. And she finally reached a point at age 35 where all of the buried emotions from that terrible experience were ready to be felt, ready to be acknowledged, ready to be honored, ready to be put into words, and they were kind of knocking on the door. But kids who go through adversity, they get very skilled at stuffing those emotions, and so the emotions couldn't reach her conscious awareness. They couldn't be something she would be able to think about. So they had to find a way out. And what they did was they manifested in her body. And in her case, they shut her bowels down. She was averaging 1 bowel movement per month, despite taking 4 different laxatives at twice the normal doses. Wasn't doing a thing. And this was my very first patient, so I had no idea about any of these concepts. But all her tests were normal, so I sent her to a psychiatrist named Dr. Kaplan, and Dr. Kaplan cured her in less than 3 months, and that was what started me off on this journey. That the idea that you could alleviate serious, real physical symptoms just by understanding a person's stress level, just by talking to them, was amazing to me. And I just thought I should at least learn a little bit about this. And I got a basic framework from Dr. Kaplan, and I started using it in practice. And then I found that there weren't any Dr. Kaplans in Portland, Oregon, where I was in private practice. And so I had to do this myself. There was nobody else. And I wasn't very good at it at first, but these ideas are so powerful that people started getting better. And that was, hugely rewarding personally and professionally. And I couldn't resist carrying on. And as of today, it's 40 years later, and I've done, this work with over 7,000 patients. I've written 3 books, co-produced 3 documentary films, co-founded a nonprofit, and been president for the last 15 years. It just kind of grew because there are so many people that need this.
Yeah, absolutely. This is amazing that you were willing to step out of, what your degree typically teaches and learn about this new thing and trust that these results were real. I mean, was that difficult at the time?
Yeah, it was definitely out of my comfort zone. I have no formal credentials in psychology. I majored in it in college, but that wasn't any kind of a training program for treating patients. And I was so grateful to Dr. Kaplan, who gave me the framework for how to think about this. And then, at the time I started in the 1980s, there were no resources. You couldn't do a fellowship or program in this. You couldn't take a course in it. There weren't any books in it. So I learned by trial and error. I would talk to patients. I would listen to them. I would try to understand the issues that they were coping with, even though oftentimes they couldn't put into words everything they were dealing with. It was almost like they were giving me jigsaw puzzle pieces about their lives, and I would have to, take in the jigsaw puzzle pieces when I didn't know what their final picture was going to look like, and when they couldn't give me all the pieces. But if you keep doing this, if you're open to it, and you're seeing 5 or 6 patients a week, you're going to gradually build up an understanding. And my learning curve was, very difficult to climb. It probably took me 5 or 6 years before I really felt like I knew what I was doing. But the turning point was, and I tell this is the lead story in my book. Is a patient who was admitted to my hospital with an attack of severe dizziness and vomiting. And when I went to see her, she said something to me I've never heard from any other patient, which was, "Thank you for coming, doctor, but don't waste your time. You'd be better off going to see your other patients." And so, I said, "What makes you say that?" And she said, "Well, I've had these attacks before." And it turned out she lived in a major university city with a prestigious hospital. And she had been admitted to this hospital, it turned out, approximately 60 times in 15 years for exactly the same attack. And of course, she'd seen, a dozen specialists, literally, and a psychiatrist, and nobody knew what was causing these attacks. So the fact that she was going to be seeing yet another doctor, and this one not at a prestigious university, but at the time I was out in a small suburban hospital, and it wasn't too surprising that she would think I was going to be wasting my time. But I said to her, I couldn't resist a challenge like that, so I said, I've kind of been making lost causes something of a specialty here lately. And, can you give me half an hour and tell me your story one more time? And make a long story short, less than an hour later, she was cured. Not only did we have a confirmed diagnosis, but just bringing that into her conscious awareness, in her case, a little unusual. Certainly can't cure people like this routinely. But in her case, just making her aware that all of her attacks were linked to interactions with her abusive mother was enough for her to, have this big, I can still remember her looking up at the ceiling with this big aha moment. And recognizing the connection, and which enabled her to put some boundaries around her mother, to protect herself emotionally. She never had another attack. She called me a year later and said, went through the whole year without a single episode. And previously she'd been having between 6 and 10 every year, half of them leading to hospitalization. So that was a huge turning point. I went home to my wife that night and I said, I think I'm really onto something here.
Yeah. Wow. That's an amazing story. I think that people might resist this kind of therapy because they believe that you're kind of, when you haven't worked with inner child experiences or your traumas from earlier life, your brain is a little bit stuck at that stage of development. And you might believe that you have to relive the whole thing on the timeline that it happened. So it might feel overwhelming, like, oh my God, it took years to happen. It's going to take years to undo. And this story highlights that no, I mean, in some cases, it could happen just with one set of awareness.
Yeah, I think, when it does happen quickly for people, and it certainly does not for everybody. I mean, some people need years of psychotherapy, but I think when it happens quickly, and in many patients, it's a matter of, weeks or months, it's because they've already done a lot of healing. They often, I meet these patients well into midlife, and their brain has been quietly working on healing from these issues for many years. And so when I encounter them, I give them a little bit more information, and they're already close to a tipping point when they first walk into my office. So I'm just giving them another little nudge along their healing pathway, and it was just remarkable to see this over and over again. The progress that people could make when they had been ill, sometimes for a very long time. I mentioned the patient for 79 years. Another one, 55 years, his symptoms went away. I sent him to a class for what was called adult children of dysfunctional families. He was a physical abuse survivor. And in the class, he had a chance to share his story with a very supportive, understanding audience. They'd all been there. And the sympathy and love and support he got from that small group of people was huge for him. And he just stopped having symptoms after that.
That's such an inspiring story. Yeah. Did you ever, you said there weren't books, there weren't classes you could take. Did you ever encounter Eastern philosophy to explain some of this? Like, because when I think about certain things like sexual abuse, it seems that the symptoms can show up in the area of the body that was physically affected. Do you see that ever? It makes
yeah. I mean, I think the Eastern practitioners probably have a handle on why symptoms appear in certain parts of the body, perhaps better than we do. Certainly, when it comes to sexual abuse, certainly sexual abuse of women and girls, the fact that the symptoms show up in the pelvis or the genitals is, not a huge shock. But as far as other parts of the body, why the symptoms appear, why somebody with a particular kind of trauma or stress winds up with migraines, and somebody else gets fibromyalgia, and somebody else gets long COVID or chronic fatigue, and somebody else gets hives. I don't think in Western medicine we have a full explanation for that. I certainly don't. Every once in a while you can make a clear connection between the particular trauma somebody suffered and particular symptom that people get. There's a book called The Lived Experience of Childhood Abuse, I believe, by a Scandinavian doctor who tells a story about a person with pain in the lower right rib cage. And it turned out that when she was sexually abused by her father, he would always put his hand exactly there where she was feeling the pain. And that was a clear connection. But most of the time, we don't necessarily see a reason why a particular symptom takes place.
Yeah, it's interesting because when you think back to the patient that had the dizziness and vomiting when she was interacting with her emotionally abusive mother, like that's not always a totally clear thing. But when I think about like energy centers and chakra systems, like the solar plexus area is our center of advocating for ourselves and maybe confidence and sense of self. And when you have an emotionally abusive mother, I could see why that might cause nausea and vomiting. But it's interesting to think about. It's really cool when we can blend the different philosophies and see what we can learn from it. I remember I took physiological psychology in college.
Me too.
Oh, okay. Yeah, in the early 2000s. And that helped me recognize that my physical symptoms had something to do with what was going on with my stress levels and what was going on in my mind. Because I experienced going to work and extremely high stress at that job. And so every time I would drive to work, I had this terrible knot in my stomach. And it was the same as your other patient where it wasn't there on the way home. And so I knew that it was the job and that I needed to move on. So I was there for a year but I knew that if I didn't stop the behavior that was causing the symptom, that I was going to manifest a much more serious condition.
Yeah, no, if you're not recognizing the source, then it can spiral. Absolutely. And many of my patients, they don't. I mean, the fact that something happened to them decades in the past could be affecting them today, that's kind of a foreign concept for most people. And because they don't see the connection, they can't address it. And if you can't address it, it just gets worse because you have, the fear about what's going on in your body, the anxiety about what's happening physically, what it might mean for your future. And that just ratchets up the tension even more. And it starts that spiral. And it's, breaking that spiral is absolutely the first thing that we want to do for people when we're treating them is to say, the doctors have checked you out. They're not finding an explanation, or if they are finding something that's not quite right, treating that is not working the way the doctor expects. That's very common, for example, in a pain in the spine, low back pain being probably the single most common. Most people over the age of 40 will have a structural abnormality of their spine just from the aging process that is not causing any symptoms at all. You go out and scan the backs of 100 people who feel fine over the age of 40, and more than half of them, there will be something wrong, but they feel fine. And on the other hand, if you've got stress-related back pain and you go to the doctor and you get an x-ray and you have one of these perfectly ordinary age-related changes in your back that don't cause symptoms in anybody, the doctors are going to look at that and say, well, you've got pain and you've got this thing there. That must be why you're having the pain. And if that abnormality, whatever it is, assuming there's, not clear evidence of nerve damage, we're not talking here about people who have loss of reflexes or clear muscle weakness or numbness of the skin in an area that's served by a pinched nerve. We're not talking about people with those characteristics because that's clearly a physical abnormality. We're talking about people with disc abnormalities and things that are not causing nerve damage. So if you do surgery for pain based on those things, if you do injection treatments or nerve ablations for those things, the success rate is about 25%, which is horrible for an invasive treatment. And many people suffer complications. It's the same with the implanted spinal nerve stimulators. You get a placebo benefit, but nothing more.
Yeah, and that makes me think of like how many people, because of adverse experiences in earlier life, they're having these symptoms. A lot of the time it's because they're not setting boundaries with people, right? The low self-esteem causes them to attract relationships that keep repeating the same dynamic they had with whoever caused the trauma to begin with.
Yeah, that's a very important point. If you grow up in an environment of adversity, what do children do to try to alleviate that adversity? Because they definitely try, and they work really hard to solve the problems in the family. They focus their attention on the needs of other people in that household who are causing the problems. One of my patients, as an 8-year-old, was trying to deal with her father's alcoholism and his rage episodes by hiding his liquor bottles. An 8-year-old should not be doing that. And of course, her father always found the liquor bottles, so she felt like a failure, which impacted on her self-esteem. And she was so absorbed in trying to fix this problem that she never really got to be a child. She never learned how to play. So as an adult, she is constantly focused on taking care of everybody else in her world, but not putting herself on the list of people she takes care of. You ask her, what do you do for your own fun, your own joy? Wasn't much there. And, if she even had some time to do something for herself, she would feel guilty if she even thought about doing something for fun. It was so much more the norm for her to think about what she could be doing that would be constructive. And then, the point you made about relationships is very important. If you grow up in an environment where you are fixated on solving other people's problems, it is entirely expected that you're going to end up in close personal relationships, romantic relationships with people who have problems, people who have issues, people who have needs that you're going to try to solve because that is what you are accustomed to. And consequently, the relationships you end up in are unbalanced. You are giving 95% to those relationships, and you're getting 5 or 10% back. And those are not sustainable. But you end one of those difficult, unbalanced relationships, but because of what you've grown up with, and because you have no concept of there being a different way to be in a relationship, you end up choosing the next person to be with who's got maybe different problems, but it still ends up as an unbalanced relationship. And getting out of that cycle involves going back, looking at the young person that you were, the child that you were, and recognizing, that butterfly on the wall, watching a kid you care about, and respecting what that kid had to cope with, which means respecting yourself. Being fully aware of the heroic perseverance that was needed to come through that early environment. And when you start thinking of yourself as the hero of your own life, you're not going to put up with any crap, frankly, in your relationships. You are going to feel like, you know what? I am a valuable human being. I went through something as a child that's the moral equivalent of getting parachuted into the Himalayas as a toddler. And I am respecting that person, that they found their way out. And you're going to insist that anybody who wants to be with you in a relationship has the same level of respect. And
Mm.
that's when you finally get to be with someone in a balanced, mutually supportive relationship. But it takes that an internal flip in your self-image.
Yeah, absolutely. I love the way you described that, because a lot of people believe that this is just all there is out there. Everybody has problems, and of course we all do, or we have quirks, whatever, but they're not necessarily huge problems. And you can find a dynamic in which you are respected and you are giving respect to the other person. It does exist.
Yeah, and the right people have a way of showing up once you make that internal flip in your self-image. I'll always remember a nurse that worked in the next office over from mine who became a patient. She had already been divorced twice. She had married two doctors, in fact, and divorced both of them because the relationships were unbalanced. And she had all of these same issues that we are talking about. And she went through the treatment process and that flip in self-image that we're talking about to coming to internally believe in the heroic perseverance she had had as a young person. She wasn't really looking to date. She was pretty much done with marriage as far as she was concerned, and not really interested in another relationship because the first two had been such disasters. But once she had made this internal flip in herself, and I had seen it in my office in having conversations with her, she was clearly a different person. She's walking out to her car one day after work, and there happens to be a guy there who's walking in more or less the same direction because by coincidence he had parked near where she had, and they struck up a conversation. And this turned out to be the guy. They were married like 5 or 6 months later and just ecstatically happy with each other.
Wow, that's beautiful. So I'm curious, when you first were doing this, what was the reaction of your colleagues around you when you decided to try to take on this new approach to medicine? Because a lot of doctors resist it. They believe in prescribing medications, and how did
Oh, they loved it. I mean, I was taking on all the patients that they didn't know what to do with. And they were very happy to have somebody do the second opinions. They would take care of doing the endoscopies and the ultrasounds and the blood tests and make sure there wasn't anything physically wrong with the patient. But, the patients were still having their symptoms. So they would send them over to me for a second opinion, and I would evaluate them for stresses past and present. I would, almost 100% of the time find something that was going on and help the patient make progress with that. And the other doctors loved it. The only thing they didn't love was that because these patients had already had all their diagnostic tests, I didn't need to do anything but talk to them. And that meant that the number of endoscopies and procedures and things that I was doing was a little below the average for my department. And there was an administrator. I had a great administrator for the first 10 or 15 years, but then he retired and was replaced with a more numbers-oriented administrator who said, Dave, you're not doing quite as many endoscopies as your colleagues. And I said, well, the nature of my practice is that, a third of my patients have already had these procedures done, and I don't need to do them a second time. So that's why I'm not doing quite as many. But being numbers oriented, they were kind of a little bit askance at that. But the doctors absolutely loved it. I mean, when I finally reached a decent plateau on my learning curve, I was voted the doctor of the year. In my organization I was with at the time, which had, they had hundreds of doctors. Usually the person who got that award was, way older than 37 years old, which is where I was when I got the award. So that was a huge honor and a real validation for the work I was doing.
Oh my goodness, that's so cool.
I thought so. You can see that actually the award is hanging on the wall behind me there.
Oh, awesome. So how did you find writing the books and starting the nonprofit? I mean, you're a doctor, you have a practice already, and you have these other things, and they're big undertakings. Yeah.
Yeah, they were. I mean, I actually had to take Friday afternoons off. I went to the administrator and I said, I have reached a point after 20 years that I am ready to share these ideas with everybody else. And, I can't possibly see every patient in the world who's got this problem, but I can write a book that is designed to help people. And the book has about 4 dozen different stories. I tried to make it as, entertaining as I could. And the stories illustrate all the different kinds of stresses that are capable of making people physically ill. And after 20 years, I had all of this experience and I was ready to share it with the world. It took me 3 years. I'm not a natural writer. It took me 3 years to write the book, but it was so well received. I mean, there was a president of the American Psychosomatic Society who was also a gastroenterologist like myself, who said it was truly remarkable. A psychiatrist at Berkeley said she read it in one sitting.
Wow.
A person I hugely admire, who was the founder of the GI department at Yale University, called it wonderful. Another professor of gastroenterology said it was the most valuable thing he'd ever read in medicine. A website said it was one of the 5 best mind-body books ever written. And I started getting lots of invitations to lecture. And the book came out in 2007. And I was so busy teaching the material from it at conferences and to residency programs and medical schools. And I just closed my practice at that point and began teaching full time. Got together with some colleagues from around the country who had found their way to this work. Very diverse group. I mean, it's amazing. People from all kinds of different professional backgrounds who had, just by listening carefully to their patients, found their way to these same ideas. And we had a meeting of the minds at a conference in Ann Arbor in 2009. And we started the nonprofit. And I did all the legal work myself. They voted me to be president. I've been president ever since. We got our IRS approval to be a 501c3 in 2011, and I've been the president ever since. And it's just grown from there. I wrote 2 textbooks, as I mentioned. I co-produced 3 documentary films. I give speeches all over North America and Europe. I taught psychologists in graduate school. I have no formal psychology credentials myself, but I found myself teaching people who were doctoral candidates in psychology in 2 different graduate schools and postgraduate programs as well. It just keeps getting bigger and bigger because there are 50 million people in the United States alone that suffer from this.
Yeah. So do you know how many practitioners there are that do this now, or?
Yeah. It started with, I think, we were aware of a couple of dozen at first. Now there are hundreds, but it's still nowhere near the need. So on symptomatic.me, we have online courses you can take. Even the courses that are for professionals, we deliberately made them jargon free. So even people who are not professionals can take those courses. We made it jargon free on purpose because we wanted the medical clinicians to be able to understand the psychological material and vice versa. So that the side benefit of that was that it's pretty much in plain English. And the concepts that are in it, people can absorb very readily. We also have, we're very excited about our membership program, people who support us by becoming members, which we desperately need because we need to grow to try to meet these needs. People who are members, there's a self-treatment course. It's text-based at the moment. We're going to convert it to a video-based one, I hope, later this year. You can join online Q&As with experts if you're a member. Every month, including one today, in fact, you can log on and get your questions answered by somebody that's been doing this for decades. So lots of other, pricing advantages. We have an annual conference. It used to be virtual, but we finally fundraised enough to get some staff who could help us put on a live conference, which is exponentially more work than a virtual one. We held it in Boulder, Colorado last September. We were hoping for a couple hundred people to sign up. We got 270 from 8 countries. Just phenomenally successful. The evaluations were off the charts. And people said it was the best conference of any kind they had ever attended. Other people said it was life-changing. So we're going to do it again, September 28th to 30th, 2025, again in Boulder, Colorado. So we hope people will join us there. So yeah, it's just whenever I get discouraged that there of this ratio of 50 million people in need to maybe 500 practitioners who do this work, and we list them in a directory so people can find them. But it's a huge imbalance. But when I look back 15 years, we've come a long way.
Yeah, absolutely. And so where do people find the titles of your books and the documentaries, and how do they?
Yeah, symptomatic.me. We got all the resources there. It's all evidence-based. We don't advocate anything that doesn't have science behind it. For the technically inclined, we have a bibliography of over 200 references that shows the science behind what we do. And there's nobody else out there that has anything like that. There are lots and lots of predatory companies out there that will sell you all kinds of supplements and devices and manipulative treatments, sometimes for hundreds of dollars, that have no science behind them at all. They often have somebody in a white coat that's behind them, and sometimes those people are even doctors, but there's no science that shows that there's anything better than placebo. Neuroplastic psychology, I will tell you about one research study that will stand in for the ones that have been done across the country. This was the Boulder back pain study. My nonprofit helped to fund it. We gave them the money and said, you guys study this, do it rigorously, see what you come up with. And they said, the same reaction I had. You want us to heal people with back pain just by talking to them? Are you kidding? And we said, no, we are not kidding. Do this, and we'll give you the money. You study it. We'll stand back, see what happens. And so they got 150 people with back pain, lumbar back pain, lumbar spine, for an average of 10 years. Randomly divide them into 3 groups. One group just got their regular same old care they've been getting for 10 years. Another group got a big injection into the spine. Huge placebo impact there. Should have done something. It didn't really help them at all. But the neuroplastic psychology group, all they got was 2 sessions a week, 1 hour each for 4 weeks. So a total of 8 hours of neuroplastic psychology sessions in 1 month, and their pain scores dropped by 75%. You have to imagine, 10 years of these people suffering this back pain, and then all of a sudden in 1 month, boom, 75%. So the next question was, okay, all right, you temporarily healed them, but is it all going to come back and there's going to be no long-term benefit? So they followed them for an additional 11 months, and the pain scores stayed down where they were. And on top of that, they said, well, what are we actually doing with neuroplastic psychology? So they scanned their brains before they got the treatment and after they got their treatment to see if any of these neuroanatomic abnormalities would shift. And sure enough, they did. The 1 month of psychotherapy, neuroplastic type, not the cognitive behavioral or anything like that, neuroplastic psychology actually physically changed people's brains, correlating with their pain drop. So just a phenomenal outcome. The benefit of this was vastly bigger than had ever been seen before using talk therapy for chronic pain. There's a statistic called an effect size, which is a measure of how much benefit have you had with your treatment. And the usual talk therapy for chronic pain gets you a number of about 0.3 for an effect size. In this study, the Boulder back pain study, the number was 1.5. So it was 5 times as effective as anything that had been published before. It got Washington Post, it got CBS News, it got Good Morning America, it got eventually LA Times, and it also, most importantly, it unlocked research money for studies across the country. And we've now got Halifax, Harvard, Detroit, UCLA corroborating and confirming these outcomes, and more research underway.
And are they adding it to their medical degree programs yet? Is that?
They are in Portland. I showed them I've been banging on the door of the medical school here in Portland for years, saying, you got to let me teach this stuff to your students. But it was only when the Boulder back pain study came out and I showed them the results, and they said, "Oh, yeah, you're right. We should have you come." So several times a year, I'm at the medical school in Portland teaching them this approach. I have to say, the physician assistant program here in Portland at Pacific University, they saw the value of this way ahead of time. I've been teaching there since 1997. Both medical schools in Slovenia are using this. And I was over there at their National Family Practice Conference about 10 years ago and gave a presentation on this. They're using my book, They Can't Find Anything Wrong, as a textbook over there, is what the dean told me. Wonderful man. I have taught this at the leading psychotherapy institute in London. It's getting out there. People are, when you see a randomized controlled trial and you see an effect size of 1.5, that gets people's attention who are knowledgeable in this field.
Yeah, that makes sense. Have you had any kind of conflict or backlash from pharmaceutical companies or any?
Not yet. If they knew about us, they'd probably be a bit worried because we offer something that is vastly more helpful in the long run with far fewer side effects than opioid medication, for example. And even the spinal cord stimulators that are used for chronic pain, they are incredibly expensive, for one thing. I think it's a $2 billion a year industry in the United States. And the benefits, they really have to struggle to show that it's any better than a placebo. And they have a significant complication rate as well. So, all of the invasive pain treatment modalities should be shaking in their boots over this, because we've got more effectiveness, longer lasting, with far fewer side effects and much less cost. I mean, it's the quadrifecta of treatment that's going on here. And we've documented it in gold standard research. So, yeah, I think in the next 10 years, hopefully I'll live to see it. We're going to have a revolution in the way pain is treated. There are so many more research studies going on. People can dismiss the Boulder back pain study and say, well, it's just one study. It might be an outlier. There might be something quirky about it that we don't understand. But now there's, like I say, Halifax, Harvard, UCLA, Detroit. The cumulative weight of scientific evidence is growing. And then all these studies that are in progress right now, when they get published, the weight is going to get bigger and bigger. And you're finally going to see the big universities, the prestigious universities that have been so focused on pharmacology and invasive treatment, they're going to be forced to take a look at this. I can almost bet they're going to say, oh, yeah, we knew about this all along. They didn't actually, but they will.
Yes. Yeah. Well, it's amazing. We need to get this message out there and have practitioners and patients demanding this type of treatment so that we can take better control over our health in the US and, Europe and everywhere, right?
Yeah, that's you're absolutely right. I should mention there's an app called Curable out there that uses this same approach, and they've taken the best ideas from my colleagues and myself and put them into a wonderful user interface. It's very inexpensive. A year's subscription is probably half the cost of an hour of psychotherapy, and it's recently been studied in a scientific trial and found to be quite effective even as quickly as 6 weeks. So I would recommend that as another resource.
Amazing. Thank you so much for what you're doing, Dr. Clarke, and thank you for being here today.
Thank you. It's been a pleasure speaking with you.
You too. And again, that's symptomatic.me to find Dr. Clarke's work. And
yeah, and we have I should have mentioned, I forgot, 12-question quiz on there. So people can get a sense, a self-assessment quiz, get a sense of whether they are having any of these issues themselves.
Awesome. So everybody go to symptomatic.me, take that quiz, and check out these books and the Curable app, and get on your way to recovery. Thank you so much. Have a great day.
Thank you.
Bye.